So today we're going to talk about the National Asthma Education and Prevention Program guidelines. And first off, we're going to start off by going over the National Asthma Education and Prevention Program purpose. So the National Asthma Education Prevention Program was initiated in March 1989 to address the growing problem of asthma in the United States. The goals of the NAEPP are to raise awareness to the patients, healthcare professionals, and the public that asthma is a serious chronic disease. Ensure the recognition of the symptoms of asthma by patients, families, and the public, and the appropriate diagnosis of healthcare professionals. Ensure effective control of asthma by encouraging a partnership among patients, physicians, and healthcare professionals through modern treatment and educational programs. To accomplish these broad program goals, the NAEPP works with intermediate including major medical associations, voluntary health organizations, and community programs to educate patients, healthcare professionals, and the public. The ultimate goal of the NAEPP is to enhance the quality of life of patients with asthma and to decrease asthma related morbidity and mortality. Now, we're going to also discuss some objectives. Some of the NAEPP objectives is for patients and the public would be to increase public awareness of asthma as a significant public health problem, increase public awareness of signs and symptoms of asthma, improve the knowledge, attitudes, and skills of patients regarding the detection, treatment, and control of asthma, particularly in high risk populations. Define guidelines for effective asthma education programs, promote development and the use of and family educational material. For healthcare professionals, some objectives will be to increase knowledge, attitudes, skills of all health professionals regarding signs, symptoms, and management strategies of asthma. Encourage health care professionals treating patients with asthma to adequately track and monitor the patient's status and use objective measures of lung function. Assist and encourage healthcare professionals, schools, and continuing educational programs to include up-to-date and accurate information on diagnosis, pathogenesis, and treatment of patients with asthma. Promote and encourage the concept of active patient participation with the physician in the management of their asthma. Develop resources and materials for use for healthcare professionals. Promote research to answer unresolved questions about underlying causes of asthma and appropriate asthma treatment and management practices. So now we're going to talk about a clinical issue, which is asthma. The key clinical activity that we're going to discuss is establishing asthma diagnosis. So while establishing asthma diagnosis, there are some action steps. First one would be to use the patient's medical history and physical examination to determine the symptoms of recurrent episodes of airflow obstructions are present. Use spirometry in all patients that are older than 5 years of age to determine airway obstruction is at least partially reversible. Consider alternative causes of airway obstruction.